Welcome everyone to this explainer. If you're planning a move to Spain, you probably already know that navigating the immigration bureaucracy can sometimes feel like trying to solve a Rubik's Cube in the dark. But don't worry, we are cutting right through the noise today. Our focus here is a strictly practical, step-by-step guide to sorting out healthcare for your Spanish visa. No fluff, no unnecessary theory, just exactly what you need to know to get your application approved without tearing your hair out. Okay, let's dive into this. Here's our roadmap for today. We'll quickly cover 1. The public healthcare check. 2. Mandatory private insurance. 3. A practical insurance glossary. 4. Your application checklist. 5. Common pitfalls. And finally, 6. An essential disclaimer. Step 1. The public health check. We really need to dispel a massive myth right away. Not every single foreigner moving to Spain immediately needs to buy private health insurance. So ask yourself this directly. Do you already have public access? I'll actually pause for a second to let you consider your own situation. Because honestly, the answer to this could save you thousands of euros and let you completely bypass the private market. What brings you to Spain? Depending on your answer, you might already be covered by the excellent Spanish public healthcare system. Well, here's exactly how you know. If you're working and contributing to the social security system in Spain, you and your family already have public health care. You literally do not legally need a private policy. What a financial relief, right? Additionally, if you don't have work access, a lot of regions offer what's called a convenio especial, which is basically a monthly fee allowing you to use the public system. So please, always check your public eligibility before spending a single euro on private cover. Let's move to and see how this builds. Step 2. Mandatory private insurance. Now, if you don't qualify for the public system, or maybe your specific visa type strictly forbids you from relying on it, you have to enter the private market. Let's clarify exactly who is legally required to hold this. The primary groups are those applying for the residencia no lucrativa, which is the non-lucrative residence visa, as well as folks on certain student visas. For these applications, private health insurance is an absolute, mandatory requirement for your stay. However, if you aren't in those categories and already have public cover, private insurance is merely an optional complement if you just want faster access to specialists. If you do fall into the mandatory category, you can't just buy any random policy off the internet. These are strict legal mandates outlined under Spanish immigration law, specifically Royal Decree 557/2011, Article 62. The policy has to have full cover in Spain with an authorized provider, and it must cover your entire authorization period. But I want you to memorize this mantra right now. Your policy must be full cover with no copays and no waiting periods. We're going to explain exactly what those mean in a moment, but that trio of requirements is totally non-negotiable for a successful application. Step 3. Our practical insurance glossary. Now, what's really interesting about this slide is the core difference in how policies actually operate in Spain. This is your toolkit to avoid buying a useless policy. You're going to see two main types of coverage. First is cuadro médico, which means you have to use the insurer's set medical network of doctors and hospitals. The second is reembolso, which means you can see absolutely any medical provider you want, pay upfront, and the insurer will refund you a percentage of the cost. Both are perfectly valid, but cuadro médico is generally the standard for visa policies. Next is a critical word, copago. A copago is simply a copay, meaning you pay an extra fee out of pocket every single time you have a medical visit or procedure. I must firmly remind you here, for a visa like the Residencia No Lucrativa, your policy must strictly be sin copago, meaning completely without copays. And the partner to that term is carencias. Carencias are waiting periods. It means you literally have to wait a certain number of months after buying the policy before certain coverages like childbirth, hospitalizations, or surgeries actually apply to you. So let's repeat our mantra. A qualifying visa policy must be strictly sin carencias so that all medical services are available to you immediately upon arrival. You might come across names in the market like Sanitas, Adlas, DKV, or Asisa. I want to state explicitly and very clearly that these are strictly examples of common insurers in the Spanish market. We are absolutely not making any recommendations here. We are offering no prices, we're doing no comparisons, and we are not insurance brokers. These are just names you'll likely encounter as you do your own independent research. Step 4. Your application checklist. Okay, you know the vocabulary, so now it's time for action. To contract the insurance as a foreigner, you need the absolute basics. Your passport, or your NIE or TIE if you already have a Spanish identity number, along with an address in Spain. But the absolute make or break document for the consulate or immigration office is the specific insurer certificate. Listen, showing up with a 50-page policy booklet will not work. Why is the certificate so important? Well, because the insurer must expressly write on it that the policy has full cover, no copays, and no waiting periods. Or in Spanish, cobertura completa, sin copagos y sin periodos de carencia. And this brilliantly illustrates exactly what immigration officials are scanning for. Without this exact phrasing, officials can and will reject your application, a heartbreak you absolutely want to avoid after months of planning. Step 5. Common pitfalls to avoid. These are the traps that lead to the most frequent visa rejections. Let's rapid fire through them. Number 1, buying a cheap policy. A bargain policy is totally useless for a no-lucrative visa. If it includes copays or waiting periods, it will just be rejected. Number 2, forgetting to request that specific, expressly worded certificate we just talked about. And number 3, forgetting step 1 of this entire explainer. Do not forget that public cover might completely suffice if you're working and contributing in Spain. Step 6, essential disclaimer. While we've mapped out a really clear path for you today, you're the one submitting the paperwork. So the crucial point is this. This explainer is for informational guidance only. It is not legal, medical, or insurance advice. You must always verify the exact, up-to-date official requirements with your specific Spanish consulate or immigration office. And remember, detailed step-by-step written guides are always available on our site. So now that you know the exact rules of the game, which healthcare path will you take to start your Spanish journey?
That was a quick overview. On our website you'll find step-by-step guides to many procedures, the Padrón, the health card, the NIE, the TIE, legalization, and more. The link is in the description. And if you get stuck, message our Telegram bot. We'll walk you through for free, step by step.